a public health consultant. How significant is that, especially in this time?
Well, we like Christmas in this part of the world, and we like to party. I mean, we're very cultural people, family and everything.
Yeah.
It's this year the difference is clear. The street lights are not lit, the popular ones we know, and it's, even though some people are not happy about it, especially with the new restrictions, not a total lockdown yet, with the new restrictions, people are not happy, but it's for the good. The numbers are spiking, and they are for real. They are really, really for real. I know that for sure. Seeing patients, and they are for real. So it's even though it's not the way we would like to celebrate Christmas, but it's better we do this year. Let's just celebrate Christ rather than celebrate ourselves.
And life, maybe.
Yeah, and life, really. I think we should just celebrate Christ this year and just have it, quiet.
I like the fact that you're talking about we're celebrating heroes, and we're going to talk about, all of those who have been great in the COVID fights and all of that. Many Nigerians have fought back the conversation that there's a virus. Meanwhile, a lot of Nigerians have also given up their time to educate other Nigerians what COVID-19 is. We had people who started on certain initiatives, to support people with COVID, whether it was with food drives. There are people who supported education. There's so many things that were done this year. A lot of food rallies. Why do you think was so important why do you think that was so important at this time, at a time like this?
All right, I think that, of course, the pandemic, it's a global thing. Yeah. So it wasn't common to Nigeria. But I think it amplified some deteriorating situations we have here already, like the health system and some emergency services and the economy itself. We had a bit of frustrations in the country. The lockdown, much trade wasn't going on, so the country wasn't really making money like that. And then the harsh economic reality on people forced them. So at a point, it was, are they going to go outside and contract COVID or stay indoor and die of hunger? So it now became which to choose. And so I belong to a WhatsApp group. And interestingly, the discussion just sprang up on the WhatsApp group. And okay, what can we do to ameliorate the situation? And then we just said, okay, let's see if we can make some financial donations and start up something. And that WhatsApp group actually contains a bit of mighty and fresh, brilliant Nigerians that actually mean so well for the country. So in the space of 4 days, about 5.2 million naira was actually raised, and just on the group. And a committee was even created from the group, a subcommittee on the WhatsApp group. And all this was done without physically meeting each other on the WhatsApp group. So it's the new leaders group, actually. And so we created a committee. I was actually part of the subcommittee for the COVID fund. And then 5.2 million, we divided it into food relief items, and medical consumables, medical supplies. So we did that 2.5 million for food, 2.5 million for medical supplies. Then the medical supplies we donated to NCDC for their isolation, the treatment centers both in Yaba and Gwagalada. And then the food items we looked at Etiosa, because then Etiosa local government in Lagos, when the state government brought out a division of the list, we found out that Etiosa had high number of the COVID cases. So we looked at Etiosa, then we also looked at Amuwo Dofin local government area because of the Abule Ado explosion then. So we felt that, okay, those two communities should be priority if we want to give out food relief items. And what we did was to budget 10,000 naira per family. So it was like giving 250 people, budgeting 10,000 naira per family.
Yeah.
So I think a lot of initiative came about, even as president of the Medical Student Association in Lagos State University. As a medical student group, we also came about a drive from our pocket, to pay if we can donate some relief items. And we did that to our mother institution, that's Lasut. And then we gave out 500 pieces of face masks and some surgical gloves too. So I think it's been awesome. most importantly, individuals have come out to know that individual responsibility at this time is actually what we need to win the battle against COVID.
So I hear you, and there were so many other things that were done. I think there was a Gift Modiale who launched a local language support initiative, COVID-19 project, in response to the wave of unconfirmed, as well as there was a lot of misinformation, when COVID started. And I think what they did were, putting out information in our local languages, to make people understand what was at stake a little better. We had people who were sharing hand sanitizers. These were companies and, individuals even. There was so much that was done. For a public health person, was there anything in particular that you wanted to see that, delighted you the most, about, sort of the spirit of giving and, people who were just doing great things and being heroes through this? What stood out for you the most?
I think we really came together and then, a lot of people did a lot of things. Yeah. So I don't know that there was so much more that could have been done. What we could afford to do, people really put their heads together and their resources together to do. However, maybe we should have. I think it was more for me about the passing information and educating people more, because the average man on the street did not even believe there was a virus in the first place. Yeah. So it's only when somebody believes there's a virus that they're going to use the sanitizers and the face mask and the everything. So I think what we could have done better, even though we, a lot was done, was information, education. Yeah. So I think that's what I would think would have, we should have done better.
I think the ultimate heroes were actually doctors, working through this and, risking their lives every day. What sort of personal stories did you hear, from, people who were working through this? There was a lockdown, but they had to go to work every day. It was almost like every day came with this new challenge for a virus or a disease that most people had no idea about. We're figuring it out as we went along,
So I would say my own personal story.
Yes, I was good. I didn't want to say. I didn't know if you had a personal story. That's what I said.
So at the beginning of the lockdown and the height of this, I worked in an isolation center. I worked in the Etiosa isolation center at the time, even though it's shut down now. On the front line, the ICU, particularly the ICU of the Etiosa isolation center. It was in April. We were employed. Okay, let's do this. It was adventurous for me because I liked the fact I was going to do something new, something different. We were just
you were not scared at the time?
I wasn't. When I was leaving home, because we had to leave home, we had to be accommodated somewhere. When I was leaving home, I just said, well, who knows? I may come back, I may not come back. Let's see how it goes. Of course, my family initially were like, are you sure? My parents were like, but I left anyways. And it was interesting. I must say, it was very, very interesting. And I applaud the frontline workers in Lagos, particularly in the Etiosa Isolation Center, to all my colleagues that work there. Because we all went, at that time, today you hear one thing, tomorrow you hear another thing about the virus, and tomorrow. So we didn't know what we were going to, but we just went. Yeah. So I applaud them because it was a great experience. I call it, when people ask me about my experience, I call it the good, the bad, and the ugly. There was a good side. Yeah, we met new people. We probably were paid a little bit more than the average Nigerian doctor. Not as though it was that fantastic compared to the risk of the job. Yeah. The bad, some of us fell ill. Some of us really fell ill. Some of us caught the virus, and I fell ill. And then there was the ugly when some of us really felt terribly ill. Yeah. And then when you see patients dying as well, I think that was one of the saddest. How
do you deal with, the denial of it? There's a huge thing in Nigeria where people don't think it's a real virus or it's not strong enough. So I've heard people say cough not the key person. They literally don't think it's that serious. Have you had patients like that, for example, who just say, no, this can't be me? Your diagnosis is wrong. How do you handle situations like that?
Truth is, it's difficult. At this point, I just tell people, obviously, I thank God for whatever it is that is protecting us in Nigeria. Nigerians, we always say God. Maybe it's a God factor, but whatever is making the strain of virus that is affecting us not to be as bad as it is in Europe and America. Yeah. Thank you, Jesus, for that. But
it doesn't mean it's any.
It doesn't mean it's any. It's when people say no or in denial. it's so hard to, where do you start from? I've seen this, I've seen people die, I've seen people, and then you really think it's not real. Oh, some people say, oh, it's just like malaria, it's malaria. Yes, the symptoms may be similar to malaria, but there is COVID and it is killing people.
Yeah.
The best you can do is just to continue to educate them and inform them. That's,
Yeah.
you really can't do so much more than that.
I completely agree. So, poverty has always been a pandemic or an epidemic. Let me use that word in Nigeria, but it's probably been amplified, by what we've seen this year. I was also part of a food drive, and it was shocking to see the numbers of people, and sometimes even the kinds of people who needed food. People you would have thought on a good day could handle this. What worried you the most, or what have you learned, coming out of this and, looking into the future to say, okay, these people are not going to suddenly start finding food after the lockdown ended or after the pandemic goes away. What sort of reality hit you with what you saw this year?
Well, I think the reality that hits me is actually the situation of the nation, actually, as we speak. So a mentor once told me that if your neighbor is hungry, your chicken is not safe. And, we are living, the difference between the rich and the poor is gradually, widening. The gap is more widening. And then you find out that even if you have money, you are surrounded by people that actually really do not have that purchasing power. So I think it was extremely, extremely interesting to see the number of people that came out to come and get food drive. We witnessed the whole palliative thing, so I think these are effects of. I think these are effects
That's taking on a whole new meaning now.
Yeah, no, I'm even talking about the lootings actually.
Exactly.
Okay,
just the word palliative now is such
I'm talking about the lootings actually.
Yes.
So you even see areas like Lekki that are actually where you will feel that okay, these are places where people that are comfortable live in Lagos, but they are surrounded by people that are so close to also still disrupt the peaceful living there. So I think it brought out the reality at hand that we're actually the poverty capital of the world. And a lot of people are actually living less than $10 a day.
Yeah.
So it's quite unfortunate.
So there's a fear that people were really stretched this year. A lot of people who were doing these drives and donations and all of that. People were not necessarily earning as much as they would have on a good day. So people were really stretched. Now there's a second wave apparently. We don't know if there's going to be a second lockdown, but Lagos is halfway there for a lot of people. What do you see happening? How are people going to be able to keep this up? Because the hungrier people are going to be around, the more there's a likelihood of, things escalating. Are you worried about, people being able to still support, if at all we get to that?
Well, it's going to be quite difficult. And I think what Lagos State government has done is what they should do, actually, just the effects that can lessen the situation of things and encourage reduced movements and things like that. So, because I don't see another total lockdown being of any good to us in Nigeria at this point in time. The molecular virologists will tell us if we are dealing with a different strain of COVID-19. That's the second wave. If it's going to be a different strain, okay, that's another fresh topic entirely. But if the clinicians still feel that, okay, the first wave and the second wave, no much difference clinically from what people are presenting with, maybe we can tackle it the same way we tackled the first wave. But I feel that the government needs to do more in terms of supporting, because even the businesses that opened for the few period of time, how many of them have enough profit to even say they want to support again during the second wave? So business, exactly.
Companies are,
so many people are cutting down staffs and things like that. So if we are not careful, it could be really, really adverse for the country.
Yeah. Well, we're here to celebrate. You guys have done amazing things. Thank you very much for all you've done, with regards to supporting Nigerians and keep putting yourselves on the line pretty much, for things to get better. And just celebrating heroes, like we said, people who have done great things through 2020. Now, starting tomorrow, Lipton and Knorr will give exceptional individuals on behalf of their customers. This means consumers can nominate someone they are thankful for this year, and Lipton and Knorr will reward and the nominated individual with a gift. Simply to participate, just tag whoever your hero is at Lipton and at Nor Nigeria. Don't forget the hashtag is Season of Thanks to stand a chance to win a gift for that special person that you are thankful for. Once again, the handles are at Lipton and at Nor Nigeria. We'll continue to celebrate those who have done great things through these times, and thank you very much for everything you've done. And please stay safe.
Thank you very
I mean, the second wave, we believe, some people say that it's not even the second wave, just a continuation of what we had. Because, I mean, it wasn't as crazy as you said, in other parts of the world, but Nigeria has never really completely tapered down. So we just saw people, like we say in Nigeria, catch brain and stay safe and do the right thing.